So 3D printing is modern technology which is coming into the medical field. It's revolutionizing the way we practice medicine. 3D printing is done from DICOM images. Basically, for 3D printing, you need DICOM images, either from CT scan or an MRI. You take the DICOM images and convert them to a standard tessellation file. This file gets recognized by the printer, and the printer prints your 3D printed model. So 3D printing in medicine is used in three different ways. One is education, second one is surgical planning, and the third one is patient-specific devices. For education, examples would be teaching medical students, residents, and fellows. It's definitely going to change the way we teach our fellows, and medical students teach residents and fellows. The reason being that getting cadavers is becoming more and more difficult in everywhere in the world. So by having these 3D printed models, we can teach complex pathologies to our future generation. For example, for surgical planning is complex surgical planning. The surgeon can plan the entire surgery by looking at the model, and then that helps in reducing surgical complications, both pre as well as intraoperative complications, post and intraoperative complications, less bleeding, and quicker recovery time. This also helps in patient education and also consenting. You can show, for a patient to understand a CT scan or an MRI is more difficult, but when they see the 3D printed models, they understand what the surgeon is going to, how the surgeon is going to operate, and how he's going to do the procedure, and that really helps them understand what's going to happen with them in the future and what kind of complications they can expect post-procedure. Yes, 3D printing can definitely be used for teaching and learning. One good example would be that, suppose there is a complex congenital heart disease case, and you just have to print one model, and that model can be replicated 1,000 times, and then it can be sent all around the world. And everyone can, each and every medical student or a resident or a fellow can look at that model, either practice surgery or learn about that congenital heart disease. That's a nice example. 3D printing depends upon what you're printing. It can take anywhere from 3 hours to, if you're printing a complex tumor or a brain, that might take anywhere up to 48 hours. That depends upon your built area. The built area is where the 3D printed model gets printed. It depends upon various things like your one is the built area, one is what kind of printer you have. Those are the two important things. It can print anywhere from, say, 1 centimeter to 4 inches, or 4 feet, sorry. So bioprinting is advanced 3D printing, and it's the future of 3D printing. Bioprinting is currently under research mode, and it's basically amalgamating 3D printing with regenerative medicine and biomedical engineering. So biomedical, some of the applications for biomedical are like making skin, like producing skin, making 3D printed organs, and organs such as kidneys and liver, so as well as cartilage. Recently, there has been massive advances in the field of 3D printing. They are now creating hollow organs, such as so that we can incorporate cells for creating vessels, regenerating vessels, that would really help in creating organs such as liver and kidneys. 3D printing is yet to reach the height. I think if you see the usage of 3D printing in medicine, in the medical field, it's less than 10% compared to rest of the industry. I think by the year 2025, it will be almost equal to any of the other, other industry leaders, other industry usage. Definitely, there's a great 3D printing is still in its infancy in medicine. I'm sure there's a long way to go. The first and most important thing to start 3D printing is to like it. You should have a little bit of technology background, which would be very helpful, because you're not only using radiology in your practice, but you're also using some computer skills. So it's nice to have some computer skills to it. So basic thing what you need is, first you need to have a motivation. Second one, you need to have a segmentation tool, which helps you to segment the DICOM images to an STL file or standard tessellation file, which gets recognized with the printer. And third thing, you need to have a printer. The printer range can vary from anywhere from a small SLA or a printer to a large multicolor color printer. So it depends upon your choice and what is required for your facility.